say, and I think most of you know this, what is the DDA? We're a component unit of the city of Ann Arbor. Broadly speaking, we have kind of two main functions. We are at our core an infrastructure organization. We take on infrastructure projects within a defined footprint, and separately, under an agreement with the city of Ann Arbor, we run the city's parking system. I'll just say that DDAs are governed by state statute, and most recently we did have our development plan, which is required, approved by council in April. That development plan is our roadmap for our work for the next 30 years. So I would say if anyone has interest in learning more about the types of work the DDA does, within that plan is a list of 150 projects and programs that we intend to accomplish over 30 years, broken down by category. So if you want to get a better idea of what we do, it's in that document. But anyway, and I'm always happy to meet with anybody. Thank you for being here. I'm going to hand it over to Andy.
Sure. Let me just say another thank you to Maura Thompson and to the DDA for not just what they do broadly in the community, but for making this space available to us today and making it useful for all of you to access. My name is Andy Labar. I'm the Executive Vice President at the Ann Arbor Ypsilanti Regional Chamber. Julianne on our team here is with us, and we are trying as a local chamber with members throughout the county to do our best work to connect you to the resources that exist in our community and to respond to some of the challenges that you are seeing specific to downtown business ownership, operating, and just that commercial and personal experience of coming to downtown Ann Arbor, shopping and running your business and being involved in the community. We are planning, based on feedback from this event, because it's a first that we've done, to take this a bit on the road with Washtenaw Community Mental Health, to Ypsilanti and to other communities around here to try and spread some of the information that is helpful in terms of how do you respond when there's issues of mental health need and crisis, how do you respond in ways that are effective and appropriate, how do you respond in ways where there is a focus on safety and decency generally. And we are trying to connect the resources that exist in this community to you, our business owners and operators, and our folks in the public sector who have a great deal of interaction here. We're so fortunate not just to be able to partner with the DDA and with all of you, but we're really glad, one, that Ryan Stanton's here from the Ann Arbor News today, because getting the message out that there should be a plan and that there are tools available, that is part of the challenge. Welcome, good morning, come on in. But we are really most excited now today to partner with Washtenaw Community Mental Health. Community Mental Health is our mental health services agency for the county. In my capacity as a citizen, I'm privileged to be able to sit on their board of directors, or not their board of directors, but their board. And Trish Cortez, their executive director, does a fantastic job running that organization, which is the biggest component of county government and has a budget of nearly $100 million once you factor in local funds, federal funds, state funds. It's a big endeavor. And she and folks like Melissa Tasker on her team have done tremendous work. But one of the things that the Chamber, the DDA, and other partners in the community can do a better job of is connecting all of you with those resources that exist and that we're fortunate to have. I will follow up after as well, because one of the things the Chamber wants to do is more of these sorts of events where we can connect you to resources directly and get you in touch with the things and the people that can help you in your day-to-day operations. But I will slide out of the way and turn it over then to the Executive Director of the Washtenaw County Community Mental Health Agency, Trish Cortez.
Thank you, Commissioner Labar. So good morning, everyone. Thank you all for coming. So as Andy has said, we are the largest provider here for mental health services. Historically, we've had kind of more limited scope in who we could serve, in that you had to be on Medicaid and you also had to hit kind of a certain level of severity of need. The great news is that over the last like 7 to 8 years, 2 initiatives. One, that Commissioner LeVar championed, the Public Safety Mental Health Millage. With that initiative, as well with us becoming a CCBHC, I'm not gonna bore you with all that, because what it all means is that a lot of that criteria of who we were able to serve has been removed. So now we can be a mental health provider for anyone, agnostic of insurance and severity of needs. So we've been growing and growing. I think our budget actually right now is closer to about $150 million, mostly in Medicaid, but then also lots of other funding. But I know what you all want to hear about today is a lot about our crisis services and a little bit of like what we've seen from the mental health perspective, and I think I know you are all seeing it too, that our landscape is forever changing and is going to continue to do so. So for example, in the last, definitely post-COVID, during COVID, there were some housing measures in place that kept people housed, but as soon as COVID, the emergency orders were lifted, many individuals nationwide, but certainly here, all got evicted from their homes, and we have seen a pretty big spike in homelessness. My experience, I've been working for CMH for, this is my 26th year, and have kind of seen, things evolve over time. And certainly, where we've typically saw homelessness mostly in our urban centers, and then even in those urban centers, they look different. So here in Ann Arbor, was a lot more camping. It was a lot more like outdoor, kind of more visibility, whereas in Ypsi, individuals were more living out of abandoned cars, buildings, etc. But now we're seeing homelessness in places in the county that we never have. We're getting called from every corner of the county. So, and with some of the federal changes that are coming, for example, Medicaid work requirements, some changes with the funding for affordable housing, supportive housing, etc. We're bracing ourselves a little bit to see that might actually be going in the wrong direction. So really important that we have this conversation here today. We're going to focus mostly on our crisis team. We've really built out our crisis team, and really not just kind of what we were historically doing, but we now have kind of continuum of care that Melissa is going to talk about. So the vast majority of what we do is, this is a term that's widely used in this city, but unarmed response. So our crisis team is available 24/7, 365 days a year. We do lots of crisis response. 88% of the time that we respond, we do it without law enforcement. So the vast majority of what CMH social workers do when they're called out does not involve law enforcement. That other 12% is usually a combination of whether we are somewhere and feel like we need law enforcement, or law enforcement is called out somewhere and they feel that we need to come and assist based on what they're seeing. So Melissa will talk more about that. But we really want to be here today to let you all know, ask any questions you have about our crisis team. What we've learned is that it's really important for us to educate the community about what can you expect and what can you not expect when you call the crisis team. So what are you going to be asked? What information are we going to try to get? What are the, where is it that we can help? We'll talk a little bit about, we already have kind of the jump usually if we know the individual on what's happening with that individual, but sometimes we don't know the individual at all, which is something that is unique to our point in time right here today. But then also, it's important for folks to also understand what the crisis team can't do. Melissa will talk about that, but really there's a line of, if someone's out of danger to themselves or others, they don't want our help, there's only so much we can do other than continue to try to engage that individual. Melissa will talk a bit about that. So this is really to have that conversation, and also, if there's time at the end, we've spoken a little bit while we were waiting for folks to show up today, of what are things that we can do to, be more collaborative partner on a regular basis. So whether that means monthly meetings with just some of our groups to find out what is all that you are seeing, what are we seeing, and how do we better coordinate and make sure that we're communicating with all of you and us and with law enforcement and others of what what are the supports that are needed, here in the downtown area. So with that, I'm going to turn it over to Melissa Tasker. Melissa Tasker is our program administrator, and she oversees all of our crisis services, as well as all of our access services. So we can talk a little bit about our crisis team is kind of like a fast track into our system. She would talk a little bit about that. And the only other member of the CMH team is Katie Honer, who I'm sure some of you know. She oversees our specialized homeless outreach team, who has a lot of presence down here too. We're located right at the annex across from the courthouse. So with that, I will let you take it over.
Sure. Hi, good morning. So I'm going to talk about our mobile crisis team and kind of what that looks like, some of the things that we respond to, and some of the services that we provide. I've also invited my friend Casey Whitford from Ann Arbor PD to chat a little bit about how sometimes our efforts overlap a little bit and how we work together, and some of the things that law enforcement can also help with, because sometimes we're the right door, sometimes they're the right door, sometimes both of us need to be present, so we're going to kind of talk about how that overlaps. All right, so we have a 24-hour hotline, so that number was 544-3050. We also, there also is 988. So 988 is a nationally recognized suicide hotline, and Michigan has its own line as well. So if you call 988 from like a 734 area code, they'll also be able to see that you're in Washtenaw County, and they'll be able to give you direct access to our team as well. So we've had really good success working with 988, but if you call our number or 988, you're going to get connected to some mental health professional, which is great. The more resources, the better. But if you call our number, you can get connected to outpatient mental health treatment. So anyone seeking outpatient care, so youth all the way through adults, for mental health and intellectual and developmental disabilities, it's the same hotline. Sometimes if folks want to talk to someone on their treatment team, we get calls from providers and parents on this line. And then we also take calls for anyone involving anyone that's in a mental health crisis. All of our calls are live answered, so I have 12 staff that answer our phones 24 hours a day that triage all those phone calls. And then I have 20 staff that work on our crisis team that work 24 hours a day. So our staff are actually, our crisis team, our mobile outreach team is housed at the annex building from about 7 a.m. to 11:30 a.m. or p.m. And then we have our midnight staff, and they are housed in one of our Ypsilanti buildings. So we are very close by. And so we are available every single day.
Where's the annex building?
So it's on 4th Street, 110 North 4th, right across the street from like Tea House and the food co-op and the courthouse building, like right in that corner. Right? Yeah. Okay, so some of the things, we get calls from individuals who are in crisis themselves. We also get calls from family members, neighbors, roommates, merchants, law enforcement, emergency rooms, outpatient providers, schools, anyone that could have connection with someone that could be in a mental health crisis, we get a call about. So we spent a lot of time talking to the caller about what's going on, symptoms that are present, whether or not they've talked to the individual or they know them, and what's going on to try to figure out what the best approach is. Mental health treatment is largely voluntary. And so, we can't necessarily force someone into mental health treatment or to engage with us unless certain factors are present. So we look for risk of harm, right? If the individual is engaging in behavior or they have symptoms that are putting them in harm's way, either intentional or unintentional, we do have ways to get them care, even if they are not necessarily willing at that point. But we do our best to really make sure that our presence is voluntary, because sometimes if the individual really doesn't want our help and there's no risk of harm, us inserting ourselves can feel really intrusive. And so we do want to be really careful to make sure that we have a kind of a collaborative effort with the individual that needs it. So for every request that comes into our line, now sometimes you're the caller, we may know a lot of things, and we can't tell you those things, right? Because of HIPAA confidentiality. But every request that comes in, we're still gonna take all of the information that you give us, and we are going to assess the following. We're gonna assess suicide and homicide risk, we're gonna assess mental status, we're gonna look for signs and symptoms that indicate they have a mental illness, we're gonna talk about their mental health history, we're gonna talk about their willingness to engage with us, we are going to see if their current behavior is destructive, dangerous, or threat to lethal. So those are the types of terms that we use in our agency. So rather than saying someone is aggressive or violent, we talk about, are they destructive? So they're not necessarily hurting anyone, but maybe maybe they're lifting a chair up, or maybe they've done something to object of some kind. They're not threatening. So yeah.
That's a question.
Yes.
So in a situation like that, like if somebody was in a business acting erratically and you're assuming, something's just not right.
Yes.
Is it better to call 988 or 911? Like what's the faster way
Yeah.
to get help?
So if someone is being destructive in your business, right? Dangerous, so threatening someone, threatening to destroy property, almost destroying property, 911 is the best and the quickest, fastest way to help. So we are down the street, but we have a response time of about 30 minutes. So if you're thinking to yourself, I need lights and sirens here,
And I think it's hard because
Yeah.
if it's just erratic behavior that is
Sure.
not necessarily violent, like
Yeah.
we all don't have the
Sure.
ability to kind of diagnose that, right?
Sure.
So I guess we always lean towards
yeah.
911.
So there's disruptive behavior, which would just be like someone maybe they're loud and yelling.
Yeah,
They're
yeah.
not really touching anything, and they're not threatening anyone, but they're just being disruptive.
Mhm.
How we handle it in our building is we ask those individuals to leave, or we attempt first to ask them to calm down, right? Without saying calm down, but we ask, we try to do our best to de-escalate them to see if we can't get their needs met. If that doesn't work, we do ask them to leave. And we do that at our CMH building. So we also use the same kind of level of protocol. If their behavior continues to escalate and they refuse to leave, that's when we do call police, because we have to think about the rest of our patients in our clinic and their level of comfort and safety as well. So if someone is in our building and they are not kind of meeting our behavioral expectations for that space, then it's okay for us to ask them to leave and maybe come back the next day. If they're really struggling, we also have trespass folks too. So Casey's going to talk a little bit about what that looks like too, because sometimes it's okay to set that boundary. We can set expectations around behavior without stigmatizing mental illness, right? So we can have expectations like, if you're going to be in this space, this is the behavior that we have to see, right, in order for us to serve you, and that is okay. And to me, that is still kind and compassionate, because it's really helping everyone that's trying to seek services or utilize your businesses. So that's kind of what we look for. Like, what type of behavior are we seeing? Are they being threatening? Are they being disruptive? Are they being destructive? What are we looking like? Because this helps determine the level of how quickly you need help, right?
Urgency.
Yeah. So if you're thinking to yourself, I need someone here within like 10 minutes, that's going to be a 911 call. If you think like, man, maybe if we could have somebody here like in an hour to check things out, 30 minutes to an hour, less urgent, then we would definitely be the ones to come in like check that out. Okay. And then we're always asking about presence of firearms or weapons. Those things are going to up the risk level for our ability to engage with someone. Okay, so after we receive the crisis response, we are going to outreach sometimes, right? It depends on who's calling, and it depends on what's going on. So if the person is calling for themselves, or if a parent is calling for their child, we can offer to outreach to their home. We can offer to meet in the community. We can offer for them to come to our building. But either way, we are working on the individual's preference. We always respond in pairs. So either two clinicians, or we have a clinician and a peer support specialist. So this is someone with lived experience who's in recovery from their mental illness or their substance use disorder. So we frequently outreach in pairs just because it is safer for for us because we're typically going and seeing people that are unknown to us, and we're going into spaces that are also unknown to us. So our goal always is to try to engage someone in the right level of care. So sometimes, we're going to attempt to safety plan with them, and when I say safety plan, we're usually making a list of strategies to keep them safe, right? So what natural supports do you have in your life? What type of coping skills? Where are you staying? What does that look like? Are you already connected with mental health care? Are you on medication? Like, what does that look like? We can get them connected to our outpatient care. So we have outpatient care. We also offer a few other levels of care options depending on the individual's needs. And there are some times when we also coordinate getting someone to the hospital for an evaluation. So sometimes someone's symptoms can be so severe that they are a danger to themselves or others, and they do need to go to the hospital for an evaluation. And so we are able to help process that. So we can assist family members to do that. We can do that ourselves. And in those cases, our law enforcement partners are usually always present because the individual sometimes has to be taken to the hospital against their will. But we take a lot of care in making sure that that really is what is needed to keep them safe. With mental illness, there is a very small portion of the population that has symptoms so severe that their level of insight and their judgment is very poor. And it's really those individuals that typically need this level of intervention. So they have, let's say, a psychotic disorder that is causing them to have delusions, and those delusions may be causing them to believe things that aren't true. And as a result of that, they may be putting themselves in danger. So typically what we see, especially let's say in the winter time, somebody walking around, let's say the downtown area with a t-shirt and shorts and like flip-flops on, right? They may not be able to regulate their body temperature. They may not understand that they shouldn't be doing that because they really could be putting their body in harm's way. Sometimes people they stop drinking or eating because they're convinced that their food is poison. So these things are part of their illness, but it could also unintentionally lead to harm to themselves. That is what we're trying to prevent. Of course, we're also talking about someone who's suicidal, so thinking about harming themselves, or homicidal, thinking about harming someone else. So those are really the criteria that we're looking for in order to get people to the hospital, sometimes involuntarily. But it doesn't happen very often, a very, very small amount. About 98% of the population that lives with a mental illness, we're never going to see. Police don't see, our crisis team doesn't see. It's a very common illness. 1 in 5 people have a mental illness, and a very, very small percentage of those have symptoms so severe that it requires this level of care.
Did you say 1 in 5 people have mental illness?
Yes.
Okay, who are you?
Yeah, it's very, very common. And most everyone lives their life just like any other chronic illness that we have. And we get, folks get treated for it, and we go about our life, right? So, and I say that just so that, we all just understand that it is really common. It's very normal. Yeah.
You want to talk now about the family members and?
Yeah, so we always try to coordinate care with the family members and the outside providers as needed. So we get a lot of calls from outside mental health providers, let's say, who need assistance with their patients after hours. The family members who are worried. We live in a college town, right? So we have a lot of parents who are calling us from out of state who are worried about their kids who are going to school here, who may have started exhibiting symptoms. So we do support a lot of families, a lot of providers in this area with folks that might be struggling. Okay, so we have in Ann Arbor a coordinated law enforcement response effort. I will say that CMH has been working alongside law enforcement in Washtenaw County for well over 10 years now, and we've done a lot of really good work collaborating together and doing a lot of training. So we call law enforcement when these things are happening. So if there's a dangerous or threat to lethal behavior that could result in harm. So if somebody's running into traffic, if somebody has weapons and intent to use them, if someone's having acute, an acute, violent, or aggressive or destructive episode, if a crime is in progress, if there's a medical emergency. So let's say they've already hurt themselves, they're struggling, and anytime we have an involuntary transport order. So sometimes when those criteria are met that I was talking about earlier, we will get an actual order from a judge that says they must go to the hospital, and sometimes we have those court orders, and law enforcement has to assist us with those. So if we get a call and it appears that this situation meets this level, we're gonna call our law enforcement partners and ask us to come with us. We'll say, hey, we're going to outreach to this house or to this place, and it seems like there's some potential there that it might go sideways. Can you come and assist? Sometimes the officer just kind of hangs back and lets us engage and just listens to make sure everything's okay. Sometimes we have a joint approach. Sometimes the individual is known to us and we know that they really do not like us, but they need support. So the officer will sometimes be the one that engages in that situation. So, but on the flip side, law enforcement calls us a lot, which is really great. So when law enforcement is dispatched, and one thing that to know in our county, if you call 911, you're gonna get an officer. So sometimes people are calling 911 for mental health crises, for other things that turn into mental health crises. And so the officer, when they're on scene, can call us and request assistance. So sometimes they'll call us and they'll say, hey, help me with this. Who is this person? What do we know? How can we help them? Or hey, can you come meet us here? This appears like we need your assistance. So they will call us. So when law enforcement is dispatched and the officer feels the individual needs mental health support, our 911 must dispatch either law enforcement, HVA, or fire for all calls. And they do coordinate with us as requested. And sometimes they'll transfer non-emergency calls, but really not that often. That is something that we're trying to integrate a little bit more. But right now, if you call 911, you're most likely going to get an officer. So it is really important that the officers that respond have a direct line of communication with us. So we work really hard to coordinate together because sometimes the situation calls for both of us, and sometimes the situation calls for just us. But we know that we are, mental health professionals. We go in pairs, but we also want to keep ourselves safe. And there are definitely situations that require a heightened level of response. So we're really thankful for our Ann Arbor partners. Casey Whitford's a really good partner of ours, and she frequents our building, and she is really mostly, a lot of the time, the officer that responds with us. So that's been really, really great. Okay, so some of our data. So we had Wayne State come in a few years ago and look through all of our data to see, kind of how things were going with law enforcement, how we were coordinating, and then how that measured up to some of the other counties in the state of Michigan. So they found that 12% of our community outreaches involved law enforcement. So that included times where we initiated, so CMH initiated those calls, and law enforcement initiated outreaches, as well as the involuntary orders that we were processing. 100% of all of our contacts resulted in a follow-up and linkage to services. So every time we get a call, we are actively working with that individual through their crisis. So we're doing lots of follow-up post-crisis intervention work. 30% of all law enforcement contacts, so they actually went through all the dispatch logs and all of the law enforcement logs, and they discovered that 30% of those calls resulted in a linkage to CMH, which seems like a smaller number if you look at it out of 100, but compared to other communities in our state, those counties only reported 3%. So we've moved the needle quite a bit, that the likelihood of an officer responding and then connecting that person to CMH is a lot higher here. And I think that's as a result of all the work that we've done to collaborate together, because that's what we want. We kind of want this no wrong door collaboration, that if you call 911, you could still get connected to CMH, right? So everybody's working together to make sure people are getting the right services that they need. 73% of our outreaches resulted in informally. So that means that we were able to keep the individual in their home, we were able to get them connected to services, we were able to de-escalate the situation, and it didn't result in them needing that higher level of care. And then post-crisis, we provide an average of about 14 contacts for every initiated crisis response. So if you call us about someone even if we can't talk to you or tell you what's going on, you can expect that we're gonna attempt and probably have an average about 14 additional contacts after that original call. So we are doing a lot of work in trying to get people connected and trying to get people to a place to avoid another crisis. So yeah. And then I invited, Casey's gonna talk a little bit about kind of how some things intersect, but before that, anyone have any questions about our crisis team? Yeah, go ahead.
Can you just give examples of like what we should say if somebody comes in to our place of business and they're aggressive or
Yeah.
combative?
I think first and foremost, you can ask them to leave, right? That is 100% in your power. Like, you do not have to entertain behavior that's not something that you're comfortable with, right? So you can say, hey, I'm not, right now it doesn't look like you're, right now is maybe this isn't the place for you right now. Maybe you come back when you're feeling a little bit better, right? You can absolutely assertively ask people to leave. It's okay to set boundaries, like, hey, right now we can't, it doesn't look like you're in the right space to be here, right? Maybe you can come back later when you're feeling better. You can also be like, ask people very assertively, I need you to leave now, right? Make those requests. We do that at our agency, right? We serve a lot of mental health clients, and we try to be very, very straightforward about what our behavioral expectations are, right? So if someone's being destructive or, dangerous, or they're threatening folks, that's kind of an immediate, like, you need to leave now, right? If someone's being disruptive, so they're just kind of yelling and being disruptive but not threatening, that's kind of when we pull them to the side and say, hey, how are things going? And that might be when they're in that disruptive phase, when you call us to say, hey, can you come and like help me with this? Because this person is struggling, but they're not, things may go sideways, I'm not really sure. That would be the time. If they kind of go past that, and their behavior becomes a little bit more dangerous, then that would maybe be a 911 call. And then if Casey comes, she'll probably then call us too and say, hey, this is what's going on. They're doing better now, but they definitely need help, right? So kind of that circular kind of intervention.
Thank you.
Question. Yeah. All right.
And to answer on that, it's really what you're comfortable with as well. So if you're not comfortable approaching the person for whatever reason, you can just call us and we'll come and take care of it. But if you're comfortable to go up to them and talk, go ahead.
Awesome. Thank you.
Yeah. All right.
Correct. So I'm Casey. I've been with Ann Arbor Police for 12 years now, and law enforcement for 16. 10 of my years here, I worked downtown. That was my favorite area. During that time, I built a ton of relationships with those that are living on the street, those with mental illness. And then I got into the community engagement unit for a short time. And then I told the police chief, hey, what I'd really like to do is get into a position that I could just do street outreach, work with CMH, work with Ann Arbor Housing, Avalon Housing. And he said, go ahead. So that's what I do now. So now that the weather is warmer, you'll probably see me walking a lot downtown, engaging with people. I'm very big into building relationships with people when they're not in trouble, so that when they do have an issue, or I need to call up CMH, they're already comfortable with me and things go smoothly. So you'll probably see me doing that a lot. I hand out a lot of cigarettes because that is like gold in that. So any questions before I start on these things, police-wise? Okay. All right, so first things first, the most important thing when somebody is in your business is you feeling safe and your staff feeling safe. So if at any time you don't feel safe, you're free to call us. If you call 911, you will get a police officer. That does not mean that we're going to arrest somebody and send them to jail. It doesn't mean we're going to write them a ticket. We usually get there, assess the situation. If it's me, I usually know the person, and we ask them to leave kindly. If they do not leave, then it's up to the business owner if they would want them trespassed. Has anybody trespassed anybody from their business? Okay. So a trespass is just a notice. It's a piece of paper where we fill out their name, address, your business information, And then you get to mark if you want it for, I think it's 30 days, 60 days, and a year now, or indefinite. So that's completely up to you. It's just a notice, so they're not getting a ticket. It's just to ask them, please leave and do not return within whatever the time amount was. If they do return after that date, then they could get a citation for trespass, or they could be arrested and just lodged at our city holding cells. The reason that they would be arrested and actually taken would be if they were like severely intoxicated, and we know if we let them go out into the community, we will get another call. So we usually take them, hold them until they're sober, and then we'll release them from our station. Disorderly behavior. So like Melissa was saying, if somebody comes in and is flipping things over in your business, is very agitated, that's some time that you would call 911 and not CMH. When we come out, like I said, we assess the situation. Sometimes we take them out of your business and then we call CMH. Once we've kind of de-escalated them, I will call CMH and say, hey, I have Joe out here and he is exhibiting XYZ signs. Do you guys mind coming over and meeting with them? And usually that kind of meeting is like 20-ish minutes. CMH will talk, I'll talk. We kind of come up with a solution of how we will go about after that. And this actually works really well, because then they have somewhere to go or something to do rather than go to jail, which that's really what we want, the right door. Calls that require a police response. Like Melissa was saying, they also call us into their office when they don't feel that it's safe for their clients or for their staff. So anytime that you feel that CMH would call us, you should call us. So if anybody is like being aggressive, if they're extremely intoxicated in your business, if they're committing a crime, stealing things, if they're taking their clothes off, something like that. Yeah, don't think that just calling 911 is going to get us there and we're gonna arrest the people. That's not our goal. Our goal is to find a solution and the right solution for them. And then as far as coordination efforts, like Melissa was saying, I work very closely with her team, the crisis response, or the crisis team. So anytime that we can call them out to a scene is great. And anytime that they need us, they'll usually just text me, they'll have my cell phone. They'll say, hey, we have this pickup order for this person. Can you meet us at this address at this time? And it usually, 99% of the time, goes very smoothly. Does anybody have any questions about these things?
I guess I have a question about public intoxication,
Mhm.
or if it's like disorderly. I do think that drug use plays into a lot of these behaviors that we're seeing recently. What if we're not actively seeing them use the drugs or alcohol, but suspect it's a public intoxication or something like that? That's a police call, or that's,
That would be us.
yeah,
Like you suspect because they are
just
passed out,
in
they're,
behavior, yeah.
okay.
just-
Yeah, that would be a police call. We would come out and depending on what they're doing, if they have an open beer or something like that, that is a code ordinance that we could just write a ticket for. We dump their beer out, hand them their ticket and they're on their way. Depending on how drunk they are, they could go back to our station and sleep it off. They could go to the hospital. But either way, usually if they're just drunk, we don't send them to jail.
Yeah.
But we do take care of the issue at that time.
Another question we've been talking about is smoking marijuana in public spaces. Is this illegal
It
or
is.
is it not? It is?
Yeah.
Okay.
So think of smoking marijuana in public just like drinking in public. It's the same thing. You
Okay.
can't drink in public, you can't smoke weed in public.
Okay, that's been something that's been a
And
very
it's-
common question in
It's
the neighborhood.
hard because it's Ann Arbor and everybody thinks, it's Ann Arbor, we can smoke weed wherever we
Yeah,
want.
yeah.
But you cannot.
So it is illegal?
It is,
Okay.
yeah. The ticket is very cheap, but, you know, you're not supposed to do it.
Okay.
How much is it?
It used to be like $50. I don't know what it is right
$5.
now. Way back, yes. Any other questions?
Most of us are open late evening
Yep.
and weekends, like Sundays and all that.
Mhm.
But I know that you said 24/7. But are your services available?
Oh, yeah. I mean, I'm not. But yes, the police are,
But-
absolutely.
Casey?
Yes. I mean, like, let's say you have somebody that keeps coming into your business often, and something is going on with them, but you're like, it doesn't feel like the police need to be involved, but I don't know if I should call CMH. You could just, I can give you my cell phone. You could just text me and say, hey, this guy has been coming in the past 5 days, this is what he's doing. Could you maybe come out and just chat with them? And I can do that. So I'll give you my cell, okay?
Do you recommend taking a photo of the person?
That is helpful, yeah, if it's in a situation that you don't feel like that's gonna make them mad. Can you give me an example of what is something happening on Liberty?
Well,
Continually.
on State Street, you know, just yesterday,
Mm-hmm,
you know, students aren't around, so it's really quiet.
Yep.
We have people fundraising, you know, asking for donations, maybe like 3 different kinds of organizations.
mm-hmm,
And then we have a guy talking to himself constantly near
The older white
7-Eleven
male.
store. The guy sitting in front of 7-Eleven store,
Mhm.
sometimes with a dog. Person across the street where
Who has,
Walgreens is.
who has an inventive foundation each week, a different cause.
mm-hmm.
This yesterday was a really active day. Very, very few people walking the streets.
Yep.
Student visitors, tourists and things like that. So it was very noticeable.
Mhm. Yeah, I mean, I most likely know all of them. So if like an incident like that, I'll give you my cell phone, you can just text me and say, hey, can you check in on this person that sits here at this time that looks like this? Because what they're doing is not illegal, it's not criminal. They're allowed to be there and talk to themselves and do whatever they want. We have lovely benches that they get to sit on. So it's not a crime, but it is also, maybe they need a little more attention from me, from CMH, from somebody to help them out.
Yeah, and what they contribute to the messiness and the, you know,
Yes.
dirt of the street and all that.
Yes.
So urchins that get out there and do stuff that many men, women, business owners aren't around. Employees don't do it. So that's a problem that we have.
Yeah. And as far as like the littering stuff, we have to actually observe it to write the citation for it. I do know a lot of the guys that were sitting on North Union State last year. When I would go out there and talk to them, I'd say, "Can you just pick up the area?" And they'll do it. But there's those few that come in and just make a mess, and then it's bad for everybody. So, yeah.
Can I just say, I think everybody deserves for it to be cleaner and healthier. If you have mental issues, it's harder for you to understand how to keep things clean. That's not something to be, they're not to be condemned for that. They need to be helped. They deserve for it to be clean too.
Correct.
And it's not healthy right now.
Correct.
And what can we do about it? Because there doesn't seem to be a crossover between the city and the cleanliness and the needs of the people who are unhoused or mentally ill. And I'm not understanding the distinction here. I think we have 2 different streams of people. People who are not necessarily, they're not going to be, have this extreme behavior that we're talking about. But they are unhoused, and perhaps they would be unhoused if there were some mental issues associated with their circumstances. That I'm not sure of. But we have unhoused people, we have people who are kind of really verging on disorderly, and we have people who are just kind of lost, and maybe they have a home, but they're not functioning very well. And it can be, for example, the other day when I was at work, I was there for 5 hours, and 2 of those hours, we had no customers because we had people, street people, unhoused people, unwell people in the store, and customers simply won't come in.
Right.
We're in Nichols Arcade.
Yep.
Which is a private property, and so anybody who is, trespassing is
Correct.
an actionable thing,
Yes.
because it's private property. We don't have solicitors and so on in there, and still, we are besieged all day long. I'm there alone. Some of the people who are there make me feel distinctly uncomfortable.
Mhm.
I would not feel, that it was easy to to call 911 in front of them. I don't want to cause an incident, so I normally just kind of ride with the flow, but the point being that it's a huge impact on our business, a huge impact. And there must have been, I think what Elmo was saying yesterday, there must have been, for every one person down there, there must have been 12 people that were trying to solicit things from them. One person, as they were going down State Street, it's like running a gauntlet. And we're losing our customer base rapidly, we're losing our vibrant State Street district rapidly. How can we all work together?
Right.
City to clean, you guys to help. For example, the guys who are sitting with the dog on the seat, that is a beautiful seat, it's true, but it's poorly placed in the crosswalk in front of 7-Eleven business, so their business is very much impacted negatively. A pit bull is a deterrent to anyone, and it's there a lot of the time. But when people are trying to go through the crosswalk, sometimes in the busy time of year, 20 people at once, they can't get through because this person is on that bench soliciting and stopping the flow, and people can't get out of the street. So we have, these are just examples, but we have a lot of issues that are not, it's not about one individual necessarily, it's not about drunk and disorderly or weapons or anything, it's just about the cumulative impact on our wonderful vibrant city that we want everybody to be welcome in, we want everyone to have a clean street, we want diversity, we want all of this, we want the benches, but in the right places, and we want them to be clean, and we want them to be safe, and so on and so forth.
Right.
So this is kind of everything I wanted to say. Thank you
Yeah,
for listening.
no, it's for sure frustrating. But as far as police goes, the stuff that we can enforce are the crimes or the codes that the city has written that allow us to enforce. But like I said, I'll give you my cell phone number, and you guys can text me whatever issues you're having, because I will meet those people, build relationships with them, and figure out what they need. Connect them with CMH. Usually they're already connected with CMH. The hard part is if they don't want the help, then we cannot force the help on them either. So it puts us in a,
We have called you before.
thank you.
We will call a couple of times in all this time. As a police officer, is there anything you can do, for example, to spot that a particular bench is dangerous and shouldn't be in that location? And with your strength of knowledge and experience, do you recommend that that bench be moved to a different
I
location?
could, but I don't know if that will be listened to.
Could you try?
Well, I think that this really speaks to the importance of having this conversation and coordination, because, you know, while Casey's trying to build relationships too, I also want to understand that on our end, you might not all see it, but we are on our end too. That really, in the mental health business, we talk a lot about engagement, meaning how do we get that person to actually decide that it is okay to come in and see a psychiatrist or see a doctor. And so for us, that level of engagement lots of times is just trying to first meet these individuals' basic needs. Because if we just walk up to them and say, hey, looks like you need to see a psychiatrist, it does not go well. Because as Melissa was saying, a lot of folks do not have that insight into the mental illness. So we have to kind of inch our way there. And for some people that could take 2 weeks. For some people we've got some stories where it's taken us 2 years to get somebody who uses very colorful language every time they see us. And eventually one day they will say, you know what, you've given me a sandwich on so many days, you've given me a cup of coffee, you know what, fine, I'll come with you to go talk to a social worker about X, Y, and Z. But that could take a long time. So you guys want to make sure, but the more that we know, because even if that individual who's sitting on the bench is already somewhat connected to us, but isn't fully engaged and isn't really willing to take that step to take medicines for their mental illness, doesn't mean we're still not trying. But they're not going to come to us and say, "Woo, you should have seen the mess I made on that bench outside of such and such." So the more we can all coordinate with all of this, the better we know where to also send our outreach teams to. Not just the crisis team, but we can all coordinate and what's the best way to engage that individual to actually begin treatment, which then can like lead to, more, housing and possible employment down the road and all those things. But it could take a long time for some individuals. Our goal is to get the right level of care. But I really think this is a really important conversation now, because we are seeing this is on the uptick, absolutely. So super happy we're having this meeting, having this conversation, and we can certainly talk more about what might be more kind of like structural things that we put in place, so that we're having a coordinated. It's not just one-off phone calls, but that's a whole other conversation to have. We really appreciate you doing all this.
Trish, I'm just gonna jump in just very quickly. One of the things the Chamber, the DDA, other merchant associations can do is try and connect you with these resources, but also to aggregate and summarize the feedback you just gave. And I think you hit it right on the head in terms of that balance between wanting to be decent to the person and welcoming as a community to the sort of the full spectrum of humanity, and also the practical realities of running a business, of maintaining enough order, that everybody can be participatory. Part of what we're going to try and do more broadly at the Chamber is take those individual pieces of feedback, communicate them to the systems of resources that exist, and try and be an iterative connection point, so that we can best align the resources and the intent we have with the practical reality of how that impacts you and others on the ground. And this conversation is part of it, because it is a good point to remember. This is a collaboration right here of city and county, of private and nonprofit, and it's something we're hoping to do more of, to strengthen and really to build on the feedback we get from comments like yours. So thank you for that. Sorry to interrupt your officer.
Well, along these lines too, I know we've been having conversations in our area, 4th Avenue, Carytown. Instead of like calling in a crisis time, we've been having conversations about, with police and CMH, about patrolling areas that tend to be
Hotspots,
yes, hotspots. Just have more interaction and patrolling in those areas before things have reached crisis. Just to kind of build those relationships and know what's going on and observe those behaviors. And I think that's something that we're hoping to accomplish, just to get the lines of communication open, so we're not necessarily having to call 911 when something really bad is happening, but we're preventing it before it gets to that spot.
Yeah, there's definitely an opportunity for more of our presence in the downtown area to really start engaging with those individuals. We have a really long history in Ann Arbor of doing just that. We befriend people and build trust, which, like Trish said, can sometimes take 2 weeks, it can sometimes take years. But our goal is to really befriend folks that we think might need our help. But just because we're from CMH doesn't mean that they're gonna trust us off the bat. So there is a lot of opportunity, and I think that continued meetings and having a larger presence of us down there to get to know some of these folks, because we've started some of that, and some of these individuals are unknown to us. They might be new to the area, and so there is an opportunity to really get to know some folks and try to get them to the right place, make sure that their needs are being met. Yeah.
A lot of what I see are individuals just trying to meet their basic needs, but in public. So like sleep, bathrooms, hygiene, food, and what I'm wondering, is there somewhere that the city or the county has where people can go to get these basic things during the day, so that they don't have to have the sort of inhumane back and forth with the way it's set up right now? It's like it's dehumanizing for them and for everybody. So like, is there a place we can say, hey, if you go 2 blocks down, you can actually get food, get a shower, take a nap?
Mm-hmm.
Is there a place like that?
So the Delana shelter has lunch every day, and they also have folks come do laundry and shower.
All day, or?
I believe you have to sign up for in a time slot, but yes. And so they do lunch and dinner. St. Andrews does breakfast every morning. So that's where folks can go get food. As far as a place to sleep during the day, I feel like that is, I think the Delana shelter lets folks in for lunch but only in the evening for sleep. So I think that is,
So this may be a gap
Yeah.
in our city and county services.
especially during the warmer months. So like during the winter months, there's daytime warming shelters that are kind of which is a safe place for folks to go and congregate, yeah.
Let me, sorry, Phil, let's jump back in.
Yeah.
So the county has a federally mandated body, the Continuum of Care, that handles the coordination of funding for homelessness services. I will bring this question up at the next meeting to see if that information is available on the spectrum of providers. And if it's not, is there a way we can make it easier? That won't answer every question and it won't meet every need because there's a pretty massive resource gap. But it at least should be able to better coordinate that information so that you can share it with somebody and we can know where the gaps are that exist.
Can I ask a question? What role does supportive connections play in all this? I know they're, run out of the city. Supportive connections, are they making, I know don't they have a team that's out on the street?
So they have 2 outreach workers. So they'll take on people that will just come into the city building that need some help and to find, like, so that the way that they explain themselves, they're the friend that makes all the friends. So like somebody will come into their office and if they need care by CMH, if they need rehab or something like that, then they find the place and
Connect
point
them
them
to
to it.
resources.
Yeah.
So, but if they do have people on the ground, but not available for merchants to say like, hey, I have someone who I think could maybe use your help here, or.
You could call them for that. Yeah. I don't know how to answer that.
And I'll just say one other thing, we talked a little bit about this before the meeting started. If this is helpful for people, this regular touch point and connection, I'm happy to coordinate and we could talk about, is it a monthly basis where we're just meeting here at the DDA, we've got CMH, we've got police, and you all come and talk about what's happening, maybe talk about the hotspots, if they're changing. If that's something we are all interested in doing, I'll just get it on the calendar, we'll have a regular ongoing meeting. So
I think
I'll
it's
just
a
throw
great
it out
idea,
there.
but I wonder how people come out. I mean, how many merchants are downtown? How many are here today?
Yeah.
We have, the State Street Association has social gatherings.
Well,
once
and
a
that's,
month.
they're never all gonna be well attended, but if word gets out and
Yeah.
you talk to your neighbors when they're experiencing problems to say, hey, we have this monthly meeting, so I don't expect we're gonna ever get a great turnout.
Yeah, you
But
gotta
we might get people
You gotta try.
coming and
I
going.
think that's
Yeah.
helpful, especially because I feel like we have been having a lot of conversations as business owners, at least in our area, of what we're all noticing and kind of working together just to point people like, hey, if you're having this recurring problem,
Yeah, come and
Come to
share,
us.
and yeah,
just opening lines of communication.
yeah.
And it makes it easier for us to respond, cause then we know
Yeah.
the things, cause if you're not calling, then we don't know. So, like you guys, if you're having issues, please call or just text me, because what's happening out there, we're not like Batman and know everything, sadly.
And there seems to be one missing piece in all of this, and that is the landlords. We often don't know who owns a building. For example, the fellow that Alma mentioned that is just talking to himself and seems to be in trouble. He's on the ground, sitting in the soil and so on, and every day it's been soil there.
The noodles.
Yeah,
Oh,
it's the
yes,
noodles.
yeah.
But there's nobody there. There's no business active in that location. Who is the landlord of that building? We have no way to know that. We would maybe give a call and say, hey, you've got somebody that looks like they're in trouble and they're on your property and you might want to do something about that. But there's no way for us to know.
Your
who that
landlord
person
might
is.
know who the is your landlord Oxford? Like maybe they would know who owns the building, and that's a.
They might, but what I'm seeing is a more overall issue that I think a lot of things have been left unaddressed. And probably if you look at your hotspots, you'll find a correlation here. Because these are absentee landlords who have not got a vested interest in that specific
So there
location
are-
other than their own personal
There are
property and
times,
not here.
I specifically remember for Moe's, when
Yeah.
it closed. And
That's
then there
another
was,
example.
yeah. So we did a lot of research and would figure out who the property owners were, contacted them and would say, hey, this is happening at your business. Will you sign an authorized agent form? So if we come across anybody who are doing these things, we can trespass them. So we have ways of
So you
figuring that out.
have ways, so we could call you and say, you know, we think something's happening at Noodles, or we think something's happening at Mo's again, you
Yeah.
know, I see it coming and going
Yeah.
there. Again, a coordinated effort of all the layers, and it just seems that is a major layer that's missing. We don't have any landlords coming to these meetings, and
Yeah.
we've been participating for a couple of years now.
I grew up in New York City, and I'm not saying that this is the way things should be, but I remember the Business Improvement Association, who had a special agent named Guido. Guido would take care of any problem you had. And it worked back then. I'm not saying things should be that way.
I just wanna, also kind of empower you and give you permission to set some, boundaries within your business and what you feel comfortable with. As someone who truly loves our population, who I firmly believe like everyone deserves to live their best life, right? We are all here doing the best that we can. Even the people that we love at CMH that we serve, we still compassionately set boundaries about behavior for them in our space. Because we want to feel safe too as mental health workers, and we want them to be safe. So you can set expectations around behavior that you are comfortable with, and it can still be kind and compassionate. So we can do both things at the same time. So just because you may feel uncomfortable and ask someone to leave, that doesn't mean that you are somehow being unkind. You can do both at the same time, and we are happy to help enforce those boundaries for you as well. And we do that every day in our building too, even for those individuals that we know and love and work with every day. Like, hey, today's not a great day for you, but we can't have you in our space, but we'll see you tomorrow, right? Or like we do have clients that we see and our building isn't the best space for them in general, and so we really focus then on outreaching to them and kind of finding different spaces that might be a better fit for them too. So we do a lot of that work as well, because we have to consider everyone that comes into our space, not just those individuals. So
I'll jump back up. I think we're kind of running to the end of the program, but I'll just say very quickly for some of you that came in after we started, the Chamber is going to be hosting a similar program with CMH with the Ypsilanti DDA. Maura talked a little bit about the potential for regular meetings. Our hope is that we can get some broader business community input and summarize some of the questions and comments and feedback that came today. So for instance, the question about landlords and so forth, how do we engage them? There may not be a perfect answer right now, but I think if we stay engaged on this issue, we can develop one. The biggest thing that we at the Chamber would love to get is, from a format perspective, how do we do a better job hosting this event next time, both here at the DDA or in this area, or also around the county and so forth? How do we make this easier for you to access as busy folks who are running and owning businesses? And what are some resources after the fact that we can connect you and your fellow merchants and operators with, so that you've got them in a usable, easy format? But I do want to say thank you to CMH and thank you to the DDA and the AAPD, because all of this was done, on an ask of them, and we really appreciate their time and resources. And they are so busy with the ongoing efforts that they have to do in these areas already. So we're trying to make good use of their time and yours, and looking for feedback on how we can do a better job in the future. Maura, I don't know if you want to say anything just on behalf of the DDA.
Yeah, I just want to echo my thanks to the Chamber, Police, and CMH. This is great, and I always appreciate the collaboration. And from my end, what I'm going to do is talk to you all about timing. Maybe it's this time, every month, whatever. Get an ongoing meeting on the calendar. I know a lot of your emails, but I'll also send it to KDA, State Street, Main Street. Just do blanket email to everybody, and we'll just start meeting monthly. And if we need to meet more than monthly, we can. but go from there.
So it has been